Hello friends, today I'm going to tell you about difference between flu and COVID-19. In this video we will cover difference between flu and COVID-19, comparison, signs and symptoms, how long symptoms appear after exposure, and infection, people at higher risk for severe illness, complications, homeopathic treatment. So let's get started. Difference between flu and COVID-19. Influenza, flu, and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. COVID-19 is caused by infection with a coronavirus, SARS-CoV-2, first identified in 2019. Flu is caused by infection with a flu virus. Compared with flu, COVID-19 can cause more severe illness in some people. Compared to people with flu, people infected with COVID-19 may take longer to show symptoms and may be contagious for longer periods of time. You cannot tell the difference between flu and COVID-19 by the symptoms alone because they have some of the same signs and symptoms. Signs and symptoms. Similarities. Both COVID-19 and flu can have varying degrees of symptoms, ranging from no symptoms, asymptomatic, to severe symptoms. Common symptoms that COVID-19 and flu share include fever or feeling feverish/having chills, cough, shortness of breath or difficulty breathing, fatigue, tiredness, sore throat, runny or stuffy nose, muscle pain or body aches, headache, vomiting, diarrhea, more frequent in children with flu, but can occur in any age with COVID-19. Change in or loss of taste or smell, although this is more frequent with COVID-19. How long symptoms appear after exposure and infection. Similarities. For both COVID-19 and flu, 1 or more days can pass from when a person becomes infected to when they start to experience symptoms of illness. It is possible to be infected with the virus that causes COVID-19 without experiencing any symptoms. It is also possible to be infected with flu viruses without having any symptoms. Differences. If a person has COVID-19, it could take them longer from the time of infection to experience symptoms than if they have flu. Flu. Typically, a person may experience symptoms anywhere from 1 to 4 days after infection. COVID-19. Typically, a person may experience symptoms anywhere from 2 to 5 days, and up to 14 days after infection. People at higher risk for severe illness. Similarities. Both COVID-19 and flu illness can result in severe illness and complications. Those at increased risk include older adults, people with certain underlying medical conditions, including infants and children, people who are pregnant. Differences. Overall, COVID-19 seems to cause more severe illness in some people. Severe COVID-19 illness resulting in hospitalization and death can occur even in healthy people. Some people that had COVID-19 can go on to develop post-COVID conditions or multisystem inflammatory syndrome, MIS. Complications. Similarities. Both COVID-19 and flu can result in complications, including pneumonia, respiratory failure, acute respiratory distress syndrome, fluid in the lungs, sepsis, a life-threatening illness caused by the body's extreme response to an infection, cardiac injury, for example, heart attacks and stroke, multiple organ failure, respiratory failure, kidney failure, shock, worsening of chronic medical conditions, involving the lungs, heart, or nervous system or diabetes, inflammation of the heart, brain, or muscle tissues. Secondary infections, bacterial or fungal infections that can occur in people with flu or COVID-19. Homeopathic treatment. Homeopathic medicines mostly used for the treatment of influenza, flu, and COVID-19 are following. Aconitum napellus 30. Anis barbarii 30. Gelsemium 1x. Eupatorium perfoliatum 2x. Rus toxicodendron 30. Dulcamara 30. Baptisia tin. Q. Causticum 1000. Influenzinum 200. Bryonia alb. Kali bichromicum 30. Ammonium carb 200. Carbo veg 200. That's all for now. Hope you like it. Thanks for watching. Doctor Online 24/7. By Dr. Sanabawani.